to Gaza. Our colleagues at the World Health Organization are warning that disrupted water and sanitation systems in Gaza, including at hospitals, are increasing the risk of infectious diseases. WHO has procured more than $400,000 worth of infection prevention and control supplies, including chlorine tablets, hygiene products, and gloves. These items have already been delivered to 5 hospitals, with plans to reach 2 others in the coming weeks. However, we keep sounding the alarm that repeated evacuation orders continue to severely disrupt aid operations in Gaza. Meanwhile, our partners say the amount of food assistance that has entered southern Gaza in July was one of the lowest recorded in the last 10 months. They warn that active hostilities, damaged roads, access constraints, and a lack of public order and safety have led to critical food shortages. Children are paying the heaviest price, with poor diet and the decimation of healthcare services and water, sanitation, and hygiene infrastructure, raising the risk of malnutrition and disease. Our partners are working to provide nutrition. Those of our partners who are working on the nutrition issues say the number of children in northern Gaza who were diagnosed with acute malnutrition soared by over 300% last month as compared to May, and by more than 150% in the south of the Gaza Strip. Without unfettered humanitarian access that allows major scale-up of support, hunger and malnutrition will only worsen. Those hot meals reached an estimated, World Food Program tells us that as of a week ago, the agency had reached some 370,000 people with partial food parcels and wheat flour this month. However, distribution in Rafah is unfortunately rare due to the ongoing fighting. WFP also distributed 4.4 million hot meals across Gaza so far this month, and that was done through about 60 community kitchens. Those meals reached an estimated 78,000 people, most of them in Khan Yunis and Deir al-Balah area. OCHA also reports that in July, the percentage of humanitarian movements denied by Israeli authorities more than doubled from 7 to 15%, severely hampering efforts to quickly reach people with critical support. This is despite the overall number of humanitarian missions coordinated by the Israeli authorities increasing from 414 in June to more than 540 in July. Meanwhile, OCHA says as of yesterday, 43% of nearly 150 planned humanitarian assistance missions to northern Gaza were facilitated by Israeli authorities this month. The rest were either denied, impeded, or canceled due to various reasons, including security, logistical, and operational reasons. And in southern Gaza, less than half of the 280 coordinated aid movements have been facilitated by the IDF in August. Turning to the polio situation in Gaza, as you will have seen, WHO confirmed yesterday that a 10-month-old baby in Deir al-Balah has polio. It's the first case in 25 years. Just to avoid confusion, this is a case that was already flagged by the Ministry of Health in Gaza earlier, but this was now confirmed by WHO yesterday. Given the risk of polio spreading in Gaza and the wider region, WHO, UNICEF, and UNRWA, as well as many other partners, are preparing 2 rounds of polio vaccination campaigns for children under the age of 10. The first round will provide vaccinations for over 600,000 children, and the second round will commence 4 weeks after the first. WHO is sending more than 1 million polio vaccines to Gaza, which will be administered in the coming weeks. UNRWA's health teams are committed to lead this upcoming vaccination against polio. Colleagues at UNRWA say they insist that on vaccinating children in both UNRWA's healthcare facilities and mobile health points within its shelters. Additionally, UNRWA mobile teams will visit communities tent to tent to vaccinate children unable to actually go to health facilities. UN agencies request all parties to the conflict to implement a humanitarian pause in Gaza for 7 days to provide this urgent health care to protect children in Gaza from polio. These pauses in fighting would allow children and families to safely reach health facilities and community outreach workers to get children who cannot access health facilities for polio vaccination. Without humanitarian pause, the delivery of this campaign will be that much more challenging. Turning to Sudan, our humanitarian colleagues tell us that flooding is heightening the risk of cholera and that it will continue to spread. WHO says that in a month since the first suspected cases were reported, more than 650 cases and 28 deaths have been reported in 5 states, primarily in Kassala, which is in the east of the Sudan. UN refugee agencies particularly worried about the spread of the disease in areas hosting refugees and internally displaced people, mainly in Kassara, Gadaref, and Al Jazeera states. At 3 refugee sites, nearly 120 cholera cases have been confirmed, as reported by Sudan's Ministry of Health, and 5 refugees have died. UNHCR is working with their colleagues at WHO, with humanitarian partners, and the Sudanese health authorities to scale up prevention and response efforts. These include providing beds, medicines, and hygiene supplies at treatment facilities in Kassala. WHO says an initial cholera vaccination campaign in Kassala has reached more than 50,000 people. Upwards of 450,000 additional doses of oral cholera vaccines are in the pipeline to be delivered. WHO has also pre-positioned cholera kits and other essentials medical supplies in high-risk states. WHO stresses that to launch and maintain a robust response to the cholera outbreak, healthcare workers need safe and unhindered access to all affected areas, as well as sustained financial support. Turning to Libya, our political mission there has called for an immediate de-escalation following reports of mobilizations of forces in the capital, Tripoli. The mission says that there are threats to use of force to resolve crisis concerning the central bank of Libya. Our colleagues say they're actively engaging with relevant stakeholders to reach a peaceful settlement and resolve the crisis. It reiterates that the display of military power in armed confrontation in densely populated neighborhoods is unacceptable and threatens the lives of civilians. Also want to flag that this morning we shared with you a press statement from the UN Peacebuilding Commission. It relates to a meeting which focused on Liberia's peacebuilding and sustaining peace priorities, in particular transitional justice and youth inclusion. The meeting took place earlier this week. And I want to flag a humanitarian crisis that we've not spoken about very much, and that is in Namibia, which is facing the worst drought in 100 years. Our acting emergency relief coordinator, Joyce Masuya, allocated $3 million from the Central Emergency Fund to support the government-led response to this crisis. 84% of Namibia's food reserves are already exhausted, and nearly half of the population is expected to experience high levels of food insecurity between July and September. That's what the Integrated Food Security Phase Classification System is telling us. The drought is contributing to an increase in severe acute malnutrition among children under 5, with deaths already reported in some regions. Our humanitarian colleagues say that women and girls who are required to walk longer distances to collect food and water, their risk of being subjected to gender-based violence also increases. The World Food Program, UNICEF, the UN Population Fund will use the money allocated from the Central Emergency Response Fund to support more than 163,000 people. This will take the form of cash assistance, treatment for acute malnutrition, rehabilitation of water supply points, and assistance for survivors of gender-based violence. And I was asked offline about the situation in Venezuela and the announcement made by the Venezuelan Electoral Chamber of the Supreme Court regarding the results of the presidential elections. I can tell you that the Secretary General takes note of the decision taken by the Supreme Court. We understand that the National Electoral Council has still not released the election results by polling stations. The Secretary General continues to call for complete transparency in that regard, and he reiterates his call for the full protection and respect of human rights and continues to urge all parties to resolve any electoral disputes through peaceful means. He is concerned about reports of human rights violations, including alleged arbitrary detention of minors, journalists, human rights defenders, members or supporters of the opposition, and others. He recalls that everyone has the right to hold opinions without interference, to freedom of expression and peaceful assembly. Today is the International Day for the Remembrance of the Slave Trade and its abolition. On this day, the head of UNESCO, Audrey Azoulay, calls on all to remember the victims and freedom fighters of the past so they may inspire future generations to build just societies. Just a programming note, on Monday, we will be joined virtually by Louise Wateridge, a Senior Communications Officer from UNRWA, and Sam Rose, who is the Senior Deputy Field Director of UNRWA. They will both brief you from Gaza, from Deir al-Balah Governorate. They will start the show at noon, and then myself and Monica